Now, when I said PCOS affects every organ in your body and not just your lady parts, I was as honest as a toddler who had just discovered the power of why and started asking questions. Now, let's dive deep into the polycystic ovarian syndrome and what are the rare symptoms or rare presentations that it can cause. Number one is the sleep apnea. It's like your breath trying to take a break, especially when you're sleeping. It's called a sleep apnea. It can be because of the hormonal imbalances, it can be because of the overweight, or it can be because of the underlying thyroid abnormalities. So when someone's sleeping, they have a sleep apnea, that is, their breath takes a break and wake up all of a sudden in a shock. That is sleep apnea for you. The second rare but possible symptom in polycystic ovarian syndrome is thyroid abnormality. Now, thyroid is an endocrine gland. There are many endocrine glands in the body, and the thing about endocrine glands is that most of the endocrine glands are interrelated. For example, thyroid, ovaries and adrenals, OAT, ovary, adrenal and thyroid, there is a specific axis which is called as the OAT axis. So thyroid gland produces thyroid hormones, ovaries produce estrogen and progesterone and androgens, and adrenal produces stress hormones, androgens and a couple of other hormones. Now these endocrine glands have to work in combination with each other, interrelated, and if any of one endocrine gland does at fault, unfortunately the effect falls on the entire axis. The OAT axis, as what people call, is disrupted because of the abnormalities. Now, polycystic ovarian syndrome, about 20 to 30% of women do have an underlying thyroid abnormality. And thyroid hormones are very, very, very essential for our metabolism. That is, our breaking down of the important nutrients and so many other, the way we function in our day is also determined by thyroid hormones. So thyroid abnormalities and the presentation of hypothyroidism, I've spoken a lot in this particular video down, so do watch it. Then, liver. All of us have heard about liver and alcohol and how alcohol can damage your liver. So alcohol initiates certain reactions or certain problems in the liver and causes what is called as a fatty disease. Now, polycystic ovarian syndrome causes what is called as non-alcoholic fatty liver disease, which means, remember I told you there is excess insulin in the body because the body deems that the existing insulin is not working because of insulin resistance. It starts to produce more and more and more and more amount of insulin, and that is called as hyperinsulinemia. Now, this hyperinsulinemia or excess insulin initiates certain reactions in the liver and fills it up or loads it up with what are called as fatty acids. Now, this fatty acid accumulation because of hyperinsulinemia is what is causing the non-alcoholic fatty liver disease. And yes, women who have polycystic ovarian syndrome do have this after a point of time. Now, is this really scary? May not be extremely scary or extremely problematic when compared to alcoholic liver disease, but it does have certain metabolic changes which will present eventually. Hair thinning or hair growth. Now, I don't think I need to talk a lot about hair thinning or excess hair growth. Polycystic ovarian syndrome causes excess androgens, and some have the presentation of excess hair growth in unwanted areas. Some other women have hair thinning, and that's about it. The other presenting symptom is depression and anxiety. Now, I have described about the typical way someone with PCOS may look, a little bit of overweight, having issues with food, unable to take nutritious diet, no much of exercise routine. All of this can be a little demotivating and, raise the chance of depression or anxiety in women. And yes, it is quite common. Around 30 to 40% of women with polycystic ovarian syndrome have issues with their mood disorders or are either depressed or anxious about the way they look. And the last and my favorite and the most important thing why you should treat your polycystic ovarian syndrome is what is called as metabolic syndrome. Now, all of you know that hyperinsulinemia initiates certain chain reactions in the body in different organs, and the most important presentation of hyperinsulinemia over a period of time is diabetes. So they tend to become diabetic and the insulin is not working, and diabetes affects every organ in your body from the liver to the heart to the intestines, the nervous system, your skin. Everything is affected by diabetes, and eventually hypertension and dyslipidemia or cholesterol abnormalities. So a combination of diabetes with cholesterol abnormalities and hypertension is what's called as metabolic syndrome. Now, this is very important because metabolic syndrome has certain complications and is also one of the major reasons why, people have heart attacks in the future, they become hypertensive, and other consequences of metabolic syndrome. Now, this is why you should identify the cues that your body is trying to give you and treat your polycystic ovarian syndrome. So this is me trying to take extra pressure to educate you about the different signs and symptoms, about the common presentations and also the rare presentation of polycystic ovarian syndrome, because it is always not a point blank presentation. I do see patients who come with complete set of different symptoms and an incidental detection of polycystic ovarian syndrome. Once detected, it should not be ignored and you have to address these issues. Now, if you think this video is important, please share it to people who are confused about polycystic ovarian syndrome, not knowing what to do, what are the actual symptoms, what are the rare symptoms, and don't forget to subscribe to my YouTube channel because I have more empowering women health content.